You've probably heard about regenerative injectables for sexual function. I mean, they're a pretty hot topic, right? They promise to help with all sorts of things, from dryness to low arousal. But the most important question isn't just, does this stuff work? It's, is it actually safe for me? So, in this explainer, we're going to walk through an expert's guide on who should absolutely steer clear of these treatments, because safety has to come first.
And the expert guiding us through all of this is Dr. Farzana Khan. Everything we're going to cover today comes directly from her medical insights, giving us a really clear clinical look at patient safety. So let's get to know her a little bit better.
To really get why her perspective is so valuable, you have to look at her journey. We're talking about a career in medicine that spans over 20 years. She got her medical degree way back in 2003, specialized in obstetrics and gynecology, and then layered on qualifications in sexual and reproductive health. But here's the cool part. Since 2017, she's also been deep in the world of aesthetic medicine, and now she even trains other doctors. It's that unique mix of deep gynecological knowledge and aesthetic skill that makes her viewpoint so incredibly thorough. All right, so here's the game plan. First, we'll talk about what these treatments are supposed to do. Then we dive into the really critical safety checks, the absolute non-negotiable reasons someone isn't a candidate, and then the more nuanced situations. We'll also touch on why your mindset matters, and, this is super important, what other great options are out there if injectables just aren't the right fit for you. Okay, first things first, the promise of injectables. Before we get into who shouldn't get these treatments, let's just make sure we're all on the same page about what they are and what they're for. So what are we talking about here? Well, we're talking about treatments that use things like platelet-rich plasma. You've probably heard of it as PRP, or hyaluronic acid. And the key idea is that these aren't just space fillers. They're designed to kickstart your body's own healing powers, to get it to repair tissue, boost blood flow, and build new collagen right where you need it most. And what kind of issues do they tackle? Well, Dr. Khan's guide points to some really common ones that tons of women deal with. Things like vaginal dryness, not feeling as much sensation as you used to, stress urinary incontinence, that little leak when you cough or laugh, and low arousal. And because these are such common problems, it is absolutely vital that the screening process is incredibly strict. And that brings us to the absolute heart of this explainer, safety first. Let's dig into the conditions that Dr. Khan flags as total deal breakers for these treatments. No exceptions. Now, I love how this is broken down. It's so clear. On one side, you have absolute contraindications. Think of this as a hard stop. A red light, the risk is just too high, period. Then, on the other side, you have relative contraindications. These are more like a yellow light. They mean slow down, be extra careful, and have a serious, in-depth talk with your doctor. It doesn't mean no, but it means maybe. So, who is on that absolute no-go list? Dr. Khan is crystal clear. First off, any active infection down there. It just makes sense, right? You would never want to inject something into inflamed tissue and risk spreading an infection. Next up, pregnancy or breastfeeding. The safety just hasn't been studied, so it's a no. Active or untreated cancer is another big one, especially gynecological or breast cancer, because you don't want to risk stimulating any abnormal cells. And finally, certain blood clotting disorders, or if your autoimmune condition is in an active flare-up. These are the non-negotiables. Okay, so we've covered the red lights. Now let's talk about those yellow lights we mentioned, the caution signs. These are the situations that require a doctor's careful, expert judgment. This is where that one-on-one conversation with your doctor becomes so critical. For instance, if you're on blood thinners, the risk of bleeding needs to be managed very, very carefully. Or if you have a chronic skin condition right at the injection site, you'd probably need to get that under control first. Same goes for things like uncontrolled diabetes, which can mess with healing, or if you've had recent surgery. None of these are an automatic no, but they all mean you and your doctor have to do a very careful, personalized risk assessment together.
All right, so we've covered the physical body, but there's another piece of the puzzle that is just as important and, honestly, fascinating. Let's talk about mind and body alignment.
And this is a sign of a truly responsible doctor. They're not just looking at your medical history, they're actually listening to you. They're trying to understand your goals. Because look, if someone is hoping an injection will fix a troubled relationship or some deep-seated anxiety, well, that's an unrealistic expectation. That's setting the treatment up to fail, and more importantly, it's setting you up for disappointment. It's all about making sure the treatment can actually deliver a realistic, positive outcome. Okay, time to bust a really common myth. A question a lot of women have is, if I'm on hormone replacement therapy, or HRT, does that mean these injectables are off the table for me? And according to Dr. Khan's guide,
The answer is a big, clear no. Being on HRT is not a contraindication at all. In fact, for a lot of patients, the two can work really well together, with injectables providing some extra benefits on top of what the HRT is already doing.
All right, here's another big one, especially in our culture that can be a little obsessed with age. Is there a cutoff? Will a doctor say no just because you've had a few too many birthdays?
And again, the answer is a resounding absolutely not. Age by itself is not a factor. In fact, Dr. Khan points out that postmenopausal women are actually some of the most common candidates for these treatments. And it makes sense because they're often the ones dealing with the exact tissue changes that these injectables are designed to help.
So, what happens if you go through all this screening and it turns out you're just not a good candidate? Well, that brings us to our final and I think most empowering section, your other expert options. This is such a critical message. A good screening process isn't about shutting doors and saying no. It's about finding the right door for you. A no for injectables just means it's time to pivot and look at other amazing, effective solutions that are a better fit for your body.
And there is a whole toolkit of powerful, evidence-based alternatives. You've got topical vaginal estrogen, which is often called the gold standard for dryness. There are non-invasive options like laser or radiofrequency. Pelvic floor physiotherapy is an incredible tool for pain and incontinence. And of course, there's psychosexual therapy, which is so essential when the root cause is more about anxiety, trauma, or relationship dynamics. There are so many paths forward.
And this quote just wraps it all up perfectly. Dr. Khan's guiding principle is all about clear explanations, realistic expectations, and shared decision-making. And that's what it all comes down to, right? It's not just a procedure. It's a partnership between you and your doctor, a team focused on your safety and your well-being, first and foremost.
So as we wrap this up, I want to leave you with something to think about. For you personally, what's the biggest takeaway here about making smart, informed health decisions? Is it knowing the right questions to ask? Is it understanding that there are always risks and benefits? Or is it just feeling empowered, knowing that even if one door closes, there are always other options to explore? Thanks for joining me.